Imagine going through a huge life change, something that affects your body, your mind, your health down the line.
Yeah.
But you can't quite find the right words for it.
Mm-hmm.
And maybe the medical system isn't quite set up to help you navigate it properly.
Right.
Well, for many South Asian women, that's not just hypothetical. It's often the reality of menopause.
Yeah.
Did you know, for instance, that for them, this whole transition often kicks off years earlier than the Western average, sometimes even in their mid-40s?
It's quite a difference.
It really is. So today, we're taking a deep dive into this area of health. It touches so many lives, but for some communities, it's still kind of shrouded in misunderstanding.
Definitely.
Our mission here is simple. Pull out the key insights from the research we've looked at, get you up to speed quickly but properly, and, highlight some surprising facts in different angles.
And hopefully provide some clarity.
Exactly. Okay, let's unpack this.
What's really fascinating, I think, is how it's not just biology. It's how deeply culture, language, and, well, systemic factors get tangled up with the biology.
Mm-hmm.
It creates this really unique and often quite challenging experience for South Asian women. We want to explore why these differences exist and, crucially, what can actually be done to improve care, whether it's in living back home or, in diasporic communities.
Absolutely. We're aiming to pull back the curtain a bit on what's often a pretty silent journey, help you understand the specific timing, the unique symptoms, those cultural hurdles which are significant, and the health risks involved.
Which are also significant.
Definitely. But importantly, we also want to shed some light on pathways to better care and support, because there are solutions.
There are.
So let's kick off with the timeline.
Yeah.
Because honestly, that's one of the biggest differences right away.
It really stands out in the data.
Yeah. Our sources consistently show that many South Asian women hit natural menopause earlier. Like you said, typically mid-40s. Compare that to around 51 for women in many Western countries.
We see figures like, 46.7 in India, maybe 47 point something in Pakistan in some studies.
Right. And while specific numbers vary, the pattern is definitely there. An earlier start.
And if we connect this to the bigger picture, well, an earlier onset means a longer lifetime exposure to low estrogen levels.
Okay.
And that's a critical factor for long-term health that often gets missed in the conversation. Essentially, you're shortening the reproductive years and lengthening the postmenopausal years without that hormonal protection.
Right.
Think about it. Every year, earlier menopause happens is another year the body is functioning without estrogen's benefits.
So when you say protective hormones and significant implications, break that down a bit. What does that actually mean for a woman's health longer term? What are we talking about?
Sure. Well, estrogen does a lot more than just manage reproduction. When it declines, bone loss speeds up, quite dramatically sometimes.
Okay, so osteoporosis risk.
Exactly. A much higher risk of osteoporosis, where bones get brittle, easily fractured. And it also affects what we call cardiometabolic health.
Heart health. Metabolism.
Yes. Increased risk of heart disease, type 2 diabetes, conditions like that. Now, here's the crucial bit. South Asian women often already have higher baseline risks for these very conditions before menopause even starts.
Right. That's a really important point.
So this earlier, longer loss of estrogen, it lands on top of an existing vulnerability, creating a really concerning health trajectory. It's something we absolutely need to be more aware of.
Wow. Yeah, that's a serious compounding effect.
Mm-hmm.
And it's not just the timing, is it? The symptoms themselves can show up differently.
That's right.
Hot flushes, night sweats.
Oh.
Okay, we all know that.
Wow.
But the sources we looked at really highlight other things that seem especially prominent for South Asian women, like really significant sleep disturbance. That can be totally debilitating.
Absolutely. And a real emphasis in some groups on joint and muscle pain, aches and pains that maybe aren't immediately linked to menopause.
Interesting.
And we absolutely have to talk about GSM, genitourinary syndrome of menopause. This covers things like vaginal dryness, painful intercourse. The clinical term is dyspareunia, and urinary issues too, like urgency, maybe leakage, more infections.
Things people really don't talk about.
Exactly. They're common, but so often just endured in silence or dismissed. The data suggests musculoskeletal pain, those aches, can be particularly high in some Southeast Asian populations. And GSM symptoms are very commonly reported among Indian women, for example.
And these aren't just minor annoyances, are they?
Not at all. They seriously impact quality of life, relationships, confidence, even just day-to-day functioning.
So, okay, if the physical symptoms are already complex and sometimes present differently, What happens when we layer on the psychological side
Yeah.
and those cultural barriers?
Oh, well, that's where it gets even more complicated.
Our sources are really clear. Psychological symptoms, mood swings, anxiety, irritability, that awful brain fog, low confidence. They're incredibly common in perimenopause and menopause generally.
Very common.
But, and this is the key thing in South Asian communities, they're often not talked about. They're really underrecognized.
Precisely. They get chalked up to life stress, or just getting older, or maybe she's just being difficult.
Right.
And what that does is it stops women connecting the dots. They don't link these feelings to the hormonal changes happening. So they delay seeking help.
Until things get really bad.
Often, yes. What clinicians describe is women finally coming forward only when the symptoms have already taken a huge toll on their work, their family life, their self-esteem, their mental health, basically, often when they're at a breaking point.
That's tough. Imagine putting up with chronic anxiety or feeling like your brain isn't working for years, just thinking this is me now, when actually there's a biological reason and potentially help available.
It's incredibly difficult.
And here's where it gets really interesting. Maybe quite sad, actually. Some of our sources point out that in certain South Asian languages, there isn't even a direct, commonly used word for menopause.
Yeah, that's profound.
How much does that linguistic gap, that sort of cultural void, affect a woman's ability to even understand what's happening, let alone talk about it or seek help?
It's an enormous barrier. It's not just semantics. It creates a cultural silence around the whole experience. It means women are going through these major biological shifts without a shared language to make sense of it or express it. Think how hard that makes it to talk to your family or, critically, to a doctor.
So instead of saying, I'm having hot flushes,
They might say they have fevers or that urinary urgency gets brushed off as just another infection. These aren't just minor miscommunications. They actively delay proper diagnosis and care because the root cause isn't being identified.
it must be incredibly isolated.
Deeply isolating. Many women feel they just have to suffer through it quietly, maybe thinking it's just them or it's just their lot in life.
That really shows how culture just shapes everything, doesn't it? Which brings us to a really critical point, this HRT gap, and how it worsens those health risks we talked about earlier.
Yes, the stats here are quite stark.
You really are. So in England, for women aged 45-55, get this, only about 6.2% of South Asian women use hormone replacement therapy, HRT.
6.2%.
Compare that to 23.3% of white women in the same age group. That's a massive difference.
It's a huge gap. And we also see delays in even getting a diagnosis. Something like 45% of women from minoritized groups experience delays compared to about 31% for white women.
So it raises that big question, doesn't it? What happens when you've got these inherent health risks we mentioned, and then they're amplified because access to care, especially culturally appropriate care, is lacking?
Exactly. And the reasons for low HRP uptake are complex. It's not just one thing.
Right.
You've got the stigma we just discussed makes it hard to even bring it up. Then there are these lingering historical misperceptions about HRT itself.
From those older studies.
Yes, from past controversies. Even though the evidence base has evolved and clarified things hugely, those old fears still kind of echo in communities and sometimes even among clinicians, believe it or not.
Language barriers too, obviously.
Language barriers, clinician hesitancy sometimes, it all adds up to create this significant hurdle, not just to getting HRT, but even just having an open, informed chat about whether it's right for you.
And we have to keep circling back to those baseline health risks because they're so important here. South Asian women before menopause already face higher risks for things like type 2 diabetes, cardiovascular disease.
That context is absolutely key. They're starting from a more vulnerable point, biologically speaking, for certain conditions.
So what worries me, based on what we're reading, is that the earlier menopause and that loss of protective estrogen adds to those pre-existing risks. It's like throwing fuel on the fire.
That's a good analogy. That estrogen decline speeds up bone loss, increasing osteoporosis risk. It worsens cardiovascular risk factors, potentially leading to heart disease earlier or making it more severe.
So it's a double whammy.
It really is. You've got the higher baseline risk, then menopause arrives earlier and effectively turns up the dial on those risks, which makes getting the right care at the right time even more critical for their long-term health.
Okay, so given all these challenges, the earlier start, the silence, the stigma, those compounded risks, what are the ways forward? What are the paths to better care? Because our sources do offer some clear and actually quite empowering solutions.
They do, and the first one is really simple, but powerful.
Yes.
Early intervention. The message is basically, don't wait until you're falling apart. ask for help early.
Makes sense. Don't wait for that breaking point we talked about.
Exactly. And HRT, when it's suitable for the individual and that needs proper assessment, it can genuinely, as the sources say, really change your life.
And it's not just about replacing hormones, is it? It's more nuanced.
Right, it's more about topping up those hormones, estrogen, progesterone, sometimes testosterone, to a level that helps manage symptoms and protects long-term health.
So less hot flushes, better sleep, clearer thinking.
Yes, but also protecting bones, brain health, cardiovascular health, which, given those baseline risks we keep mentioning, is particularly vital. For most women in the right age bracket, the benefits, when it's prescribed properly, generally far outweigh the risks.
So it's proactive health management, not just symptom control.
Okay.
And a massive piece of this puzzle, obviously, is culturally sensitive care. What does that actually look like on the ground? It's more than just leaflets in different languages, right?
Oh, much more. It's about creating what the experts call culturally safe spaces, offering culturally competent care. Meaning healthcare professionals who aren't just menopause experts, but who also understand and respect the cultural background, the potential language issues, the specific beliefs or hesitations within South Asian communities.
Building trust.
Exactly. It's about open, non-judgmental conversations where women feel truly heard and understood, not just ticking boxes on a medical form, but understanding the context.
And that leads to better outcomes.
Absolutely, because women then feel safer opening up about symptoms they might have felt ashamed of or maybe didn't even realize were linked to hormones. It allows care to be tailored properly, not just a generic approach.
That makes complete sense. And there are actually models for this working well, aren't there? I think Sri Lanka came up.
Yes, that's a fantastic example. Sri Lanka has this nationwide Well Woman platform.
Okay.
And they've basically integrated menopause support right into routine health services. It's not a separate stigmatized thing. It's just part of a regular checkup.
That's clever. It normalizes it.
Completely normalizes it and vastly improve access. It shows how embedding this care into existing community health structures can be a real game changer, especially in cultures where silence has been the norm. It's a great clue for how diaspora communities could maybe adapt things. Prevention and early support work much better than waiting for a crisis.
Definitely food for thought there. And that idea of personalized care is key too, right? The National Institute for Health and Care Excellence in the UK, their guidelines are pretty clear on this.
It's very clear. NICE recommends an individualized menopause assessment for every single woman. It's not a one-size-fits-all situation.
So what does that mean in practice?
It means looking at the individual. Her specific symptoms are vasomotor symptoms, like hot flushes, the main issue. Then HRT should be offered if it's suitable. Are GSM symptoms vaginal dryness, discomfort the problem? Then local vaginal estrogen is often a brilliant, very safe option because it barely gets absorbed into the rest of the body.
Right.
It's always about understanding her symptoms, her medical history, her risks, and her preferences to create the best plan together.
And what if HRT isn't suitable, or a woman prefers not to take it? Are there other evidence-based options?
Yes, absolutely. There are effective non-hormonal treatments, particularly for those vasomotor symptoms, the hot flushes and sweats.
Like what?
Well, certain antidepressants, SSRIs and SNRIs, can work really well, even at low doses. Gabapentin, a drug often used for nerve pain, can also help reduce flushes. And there's a newer non-hormonal drug called fezolinetant, which works on a specific brain pathway involved in temperature regulation.
Okay, so there are medical alternatives. What about lifestyle stuff?
Crucial. Absolutely crucial. Things like sorting out a good sleep routine, same bedtime, wake-up time, even on weekends if you can manage it. Staying active doesn't have to be marathon running. Just regular movement makes a huge difference to mood and symptoms.
And diet.
Yes, focusing on nutrition, making sure you get enough calcium and vitamin D for bone health is really important. As for complementary therapies like herbs or supplements, the evidence is often a bit mixed. It's always best to chat those through with a doctor because they can sometimes interact with other medications.
Right, good advice.
Yeah.
So what does this all mean for you listening to this? It means there are many evidence-based ways to manage menopause. You absolutely deserve good quality, personalized care that gets your unique situation, your cultural background. You don't have to just put up with it in silence. Help is definitely available. So this deep dive, I think it's really shown us some critical things about menopause for South Asian women. That earlier onset, extending the time without estrogen's protection, that silent struggle made worse by stigma and sometimes even the lack of words. Those compounded health risks making timely care even more important, and crucially, the power of culturally sensitive individual care. Just knowing these nuances hopefully empowers you to advocate better for yourself or for the women in your life.
Precisely. And this knowledge isn't just interesting facts, is it? It's really a call to think differently, maybe act differently. Consider the power, just the sheer power of one single conversation. One chat that breaks that silence, that starts the journey towards reclaiming wellness for yourself or for someone you care about. Menopause is a natural stage of life. It's not a disease. And with the right knowledge and support, it absolutely can be navigated with dignity, with understanding, and with better health outcomes long term. Every woman deserves that.